Hi, I'm Dr. Jodie Ann Senior. I am a heart failure specialist and cardiologist, and today I would like to share something with you that I talked to one of my patients about during the week, and that is a leaky valve. What is it, and what does it really mean when a valve leaks? I thought about this because when I was talking with my patient, I realized that she didn't really understand what I was saying when I talked about a leaky valve. And I thought, this is a term we use all the time to explain to patients a situation. The valves in the heart can, if they're not closing properly, what we get is a degree of regurgitation or regurgitant flow. And this is what we're terming the leak. But I realized it's not a great term because she said to me, well, where does it go? I said, where does what go? She goes, well, the blood, where does it leak to? I said, oh, okay. You're thinking it leaks out of like where it should be, the blood in the body, in the vessels or in the heart, and it's leaking out into the body somewhere else, some other cavity or something. And no, that's not what's happening. It's actually not like that. So let me explain. I'm sorry for the window and the chalk rather than a whiteboard, but this is what we've got at the moment. So let's first of all start with a little bit of basic anatomy in the heart. Two small chambers, two larger chambers. And because if we were facing this way, this is my left, this is my right. So in actual fact, this is the left side on this diagram. This is the little left atrium, flows to the left ventricle. This would flow out to the body via the aortic valve here and then come back via the venous return to the right atrium, which would then go to the right ventricle, and then this would go back to the lungs to get oxygenated all over again. So we have valves separating those chambers. On the right side, we have the tricuspid valve there, and then we have the pulmonary valve here that goes out to the lungs. When the blood returns to the left side after going to the lungs, so it can then go to the rest of the body and oxygenate your organs, we go through the left atrium. There's a mitral valve sitting here, and then an aortic valve, which then leads out to the aorta, which takes the blood around to the rest of the body. So the valves are designed to keep the flow in the heart moving forward with each beat rather than allowing it to go backwards. When it's going backwards, it's usually because we have this dysfunctional heart valve, and that is where we get the terminology of the leak. But if you can imagine, if that's the mitral valve there and the blood is meant to be traveling this way, when the blood then goes backwards, this valve should close and no flow, or minimum next to no flow, should go through back to the left atrium. It should really keep going forwards or hold in that chamber and then to be pushed out to the rest of the body. So if we look at that a little bit closer, if you can recall, the left ventricle has a valve here that then flows to the aorta here, and so this is the aortic valve. If we did a cross section of the aortic valve, it's actually should be a tri-leaflet valve. Although some people don't have 3 leaflets, they only have 2, which look maybe more like that. But if you imagine, when the ventricle squeezes and contracts, if that valve was closed, no blood could get out. So the valve has to open up for the blood to flow out to the aorta and get out to the rest of the body. when that ventricle relaxes, the valve should shut. Now, because the ventricle is relaxing and this is a closed circuit, it's in a vacuum, then all the blood would want to go backwards. But as that happens, this little valve's like a kind of a parachute. It comes across and it closes, and it stops the flow from going backwards as all of that relaxes. And it wants to go backwards, but this is designed not to let it happen. But if the valve does not close properly, and say it's over here and you've got this hole here, then you start getting this regurgitant flow or backwards flow. And that is what we that we call aortic regurgitation. We call it a leaky valve. It's only because the valve isn't capturing all that flow and stopping it from going that way. But in actual fact, that's what it is. It's regurgitant flow. And really, you can think of it as forward flow, and then you shouldn't get backward flow, but you get backward flow. That trileaflet aortic valve, when it's open, all the blood flows through. When it closes, you should get just schematically something like this, where the valve comes in, should really meet most places, and you don't get much of a gap. But some valve leaflets, they're a bit tented here, and they don't come quite in, and then you get this sort of space, and then you get flow, and then as the stress on that and the pressure on that gets more, or you get, more calcification and hardening, and that valve has harder and harder to open, you can get some stenosis, which means it blocks and it doesn't open up properly, it doesn't allow flow through, or you get this regurgitant flow because it doesn't close properly, and you get what we term the leak, the backwards flow, which I think is a better term, probably backwards flow. So these are the things that can happen to our heart valves, and if they aren't working properly, then they can cause a severe flow problem, a severe backward flow problem, for example. And either then we need that valve fixed, repaired, or replaced to stop all that happening, or it will cause heart failure. So these leaky valves can cause heart failure. They are one of the known causes, valvular heart disease, of heart failure. So if you wanted to learn more about other causes of heart failure, I have another video on that. I will link this video to that one so that you could go back and listen to all the different things that could cause heart failure. So if you have heart failure, but this isn't your cause and you don't need to know about that, no problem. Go have a look at some of the other things that you might want to know more about. But yeah, this one comes up a lot, especially when we're reviewing the cardiac ultrasound or echocardiogram, where we may talk about some of the issues on that, like how well is the heart pumping, how is it squeezing, what is the ejection fraction, and I've got that explained in one of the other videos, or how are those valves working, for example. And when we talk about the leaky valve, you now know what that refers to. And I'm sorry, it is really a bad term, I think. But it really is just describing backwards flow when there should be very little. And the idea is for continuous forward flow to happen, and then very little backflow to occur. So hopefully that helps explain that. I hope I didn't make that harder to understand, because that was not the intention. If you like this, please like it or leave me a comment. If there's anything I didn't explain well or anything you wanted explained that I didn't talk about, this will help me do future videos to help better educate all you guys out there with heart failure that might not have a lot of access to this kind of information. And I hope I am giving it to you in a form that is easy for you to understand. Again, please give me feedback on that. But yeah, if you like my videos, please subscribe so you don't miss any of them. And please let me know also if there are other topics you would like covered. This will help me a lot. Thank you very much for your time and attention, and hopefully I'll see you next time.